Hey y'all, Katrina here. I just want to get on here really quick to talk about respiratory illnesses. Okay, and this is going to be practical advice. Okay, we're not talking about no spirits, we ain't getting to the root of it. Practical advice. Okay, so and this is regarding like the common cold, the flu or influenza, and COVID. The symptoms people have: congestion, stuffy nose, headache, sneezing, coughing, body aches. So I just want to mention this because a lot of people go to the ER and they say things like, "Oh, I went to the hospital, I went to the ER, and they didn't do anything," right? And chances are you didn't need to be there. That's why they didn't do anything, right? But I just want to say that when it comes to respiratory illnesses, they have to run its course. Okay, you could try natural remedies or over-the-counter medications that help with your signs and symptoms. So if you have congestion or you got a stuffy nose or a running off or a cough, there are medications you can buy from the pharmacy over the counter that will help with those symptoms that you have. Right, you don't have to run to the emergency department for every little thing or urgent care or go to the doctor's office. Right, so some natural things or natural remedies you can do, and this is something you can do all year round, not just the quote unquote flu season, which is not a real thing, or just when around the time when it's the fall or the winter. So you want to stay hydrated, you want to get rest. You want to use a humidifier or steam inhalation if you're using heat in the wintertime or when it's cold, so it can moisturize the air. You can do salt water gargles for throat discomfort. You could try honey and lemon. Honey has natural antibacterial properties, and it can also soothe a sore throat. Ginger tea. Ginger has anti-inflammatory effects to it. Vitamin C, zinc supplements, elderberry, and garlic. Those can all boost your immune system. And again, other than that, you should be taking care of yourself all year round. You should be drinking water, taking vitamins. If you're not eating a well-balanced diet, you should be eating healthy. Eat something healthy. Exercise. You should be get moving. So you don't want to wait until the fall to start doing those things like taking vitamin C shots and ginger shots. Just take care of yourself all year round. And a lot of people need a primary care physician, a PCP, to get somewhere you go, a doctor's office that you go to get annual checkups. Okay, every year, once a year, y'all got it within y'all to go to the doctor once a year at the beginning of the year or some point in time. Go get a checkup. Okay, go get a checkup, get blood work, fasting blood work. Don't eat after midnight. Okay, drink you some water in the morning, get yourself hydrated so it'll be easier to draw blood from your veins. Go see the doctor. Don't say you don't have insurance, find a free clinic. Okay, get annual checkups. You need to be getting your blood sugar levels checked, you need to be getting your cholesterol levels checked, the whole nine yards. If you're a woman, you need to be going to the GYN. Okay, going to the gynecologist, getting that uterus swab so they can send it off to the lab, see what you got going on. If you're sexually active, you have multiple sex partners, go even more sooner. Go more often. If you have high risk behaviors, go get checked out more often than just once a year or once every 2 to 3 years. Go get checked out. And that's not even in my notes, y'all. I be going off on a tangent, but stay with me, right? So yes, a lot of people need primary care physicians, and these are doctors that you're going to go to once a year. And if you have any other conditions or chronic health conditions, they can refer you to a specialist, but you should have a doctor that you go to get annual checkups. Okay. When it comes to respiratory illnesses, like I said, you want to seek help with for shortness of breath or if you have difficulty breathing, and not because your nose is stuffy. Oh, I'm having a hard time breathing. Yeah, you got snot in your nose. I'm talking about like that sudden shortness of breath. If you're not doing it, if you sitting down watching TV and you having shortness of breath, you get up to walk to the garbage and you having shortness of breath. Not if you exercising or you overweight and you walk up steps and you out of breath. I'm talking about sudden onset shortness of breath, meaning I'm not doing anything strenuous to be having a hard time breathing. Then you want to go to the ER for something like that. Okay, you should seek medical advice or dial 911 if you have to. Let's talk about the common cold. So the common cold, within 1 to 3 days, you may pick up, after picking up the virus, you may get symptoms like sneezing, runny nose, headache, sore throat, cough, nasal congestion. A fever is most common in children, but it can happen in adults, of course. After 4 to 7 days, you may have body aches, headache, runny nose, or fatigue, and after 8 to 10 days, you may just have a nagging cough. Okay, and most people gonna get a cold plenty that you'll probably get the common cold most times in your life. Now, the common cold is caused by a rhinoviruses, right? Up to 50% of common colds are caused by a rhinovirus. I'm saying virus, I'm emphasizing that because I'm gonna get to my next point. So there are more than 100 types of rhinoviruses, right? So a lot of people, again, like I said, they go to the ER or they go to the doctor and be like, they ain't do anything, it's a waste of time. Yeah, there's no magical pill that's going to make your signs and symptoms disappear. Yeah, and so what happens is if you go to the doctor, right, and the doctor can tell and gauge out that you want some medication for your cold or for your stuffy nose because you think this is going to help make it go away quicker. When it really has to run its course, a lot of doctors tend to prescribe antibiotics for people who have a cold, and it don't work. Okay, it don't work because antibiotics don't kill viruses; they kill bacteria. And so if the cold is caused by a rhinovirus, why would you go to the doctor and let them prescribe you antibiotics, right? Because they know that you're seeking. Because what does it look like? If you go to the doctor and they don't give you no medication, you're going to be like, I went to the doctor, he didn't do anything. You know, like people always say, oh, I went to the doctor and they didn't, I went to the ER and they didn't do anything. Yeah, because you don't need to be there. You can, a lot of things can be taken care of at home. So yeah, so antibiotics don't kill viruses, they kill bacteria. So again, you could try over-the-counter medications that can help with your signs and symptoms that you're having. The flu has similar signs and symptoms. There are some emergency warnings. So if there's difficulty or fast breathing in children, or dehydration or rib pulling, I mean, like they breathing and they working very hard to breathe, then you may want to seek some medical attention. And for adults, if they having difficulty breathing or shortness of breath in adults as well, but that sudden onset, not because your nose is stuffy type, I'm having a hard time breathing. Or in an adult, if you have persistent chest pain or pressure, or if you have chronic health conditions, but they're worsening because you have the flu or COVID or something, then that makes sense. Then you will go seek help. And one of the complications of the flu is pneumonia. So you don't want that mucus and stuff to settle in your lungs because it can lead to pneumonia. Then you will have another whole set of problems. COVID, we all know about COVID by now, I believe. So I'm not going to talk about COVID, but I have had patients or triage phone calls where patients will call and say, oh, I took a COVID test and it was positive, but I don't have any signs and symptoms. And then I be sitting there thinking to myself and let them, so what is it you want me to do? Like, why are you calling the the doctor's office, especially after hours, or, they close or it's the weekend. But anywho, there's a saying, if it's not broke, don't fix it. And that's something that I live by. I'm not going to go looking for trouble or looking for issues. If I don't feel like I'm sick, or if I go do a COVID test and it's positive, let's say somebody say, oh, I have COVID. So I'm like, let me go. I was around someone with that and I go get tested and I don't have symptoms. I'm not going to go to the doctor and be like, yeah, I took a positive COVID test, but yeah, I feel fine. Nothing's bothering me. Why are you here? Like, if it's not broke, don't fix it. If anything, just go take stuff to help boost your immune system, just in case if something try to creep up. But you don't have to go to the doctor or call them or go to the ER because you had a positive COVID test and with no signs and symptoms. It's like, okay, I've actually had patients be like, oh, I have arthritis and my joints was hurting. I took a pill for it and it went away. And I had a headache and I took some extra strength Tylenol and it went away. I literally was on the phone with a patient one time and she told me everything she did and how everything was better. And I said, ma'am, what exactly is it that you want from me? Like, what do you want me to do? Oh, I thought I'd just tell y'all, don't, because your clinic is closed or your doctor's office, the practice is closed. And again, this is a call center. I'm triaging phone calls. They're not going to see my notes. So they're not going to know that you called to say, oh, my joints were hurting, while I am going to document everything you said. That your office, your doctor not going to see what I typed in my notes. So it's like, don't waste people's time. All in all, I wanted to get on here to say, think about it. Okay, listen, Linda, listen. Think about before you run to the ER and waste money and waste time and waste resources because your nose is stuffy or, you got a headache, unless it's something that's chronic or if it's like the worst you ever experienced in your life. For stuff that okay, this is a cold or it's flu or it's COVID, unless you are having a hard time breathing, You don't need to call 911. You don't need to go to urgent care. You don't need to go to the ER. Okay. If you're not having something that's considered an emergency, I know feeling miserable, having no symptoms, it don't feel good. I don't like having no headache. I don't want no stuffy nose. I don't want to be coughing either. But I know not to run to the emergency department for that. And I used to even have this job where I should triage 911 calls. Oh my gosh. You would be surprised at things that people call 911 for. There is such a shortage with EMT workers and paramedics that even people who are having strokes and heart attacks, they don't even have the ALS, like the advanced life support ambulance, to get to them quick enough because they're so behind. This is in all states all over the country. Because when I triaged those 911 calls, we took phone calls from all over the states, all over the US. And it's such a shortage. So to think that you're going to go call 911 or go into the ER because you got a stuffy nose and a sore throat and then say they didn't do anything, I'm not sure what people be looking for them to do. It really is and truly a waste of resources. So I just wanted to get on here to say that. Take care of yourself all the time. Okay, bye.